Okay, for the sake of time and not stealing from our presenter, I will go ahead and kick us off and get it going. Um, Welcome to Sam Houston State University's March CME offering. Today, it's going to be on giving meaningful feedback, and that is hopefully what you were expecting to see. And if not, hopefully it's really great information that you learned from anyways. Our speaker today, you've probably seen before if you've already joined us, is Ms. Claire Collins. She is the Director of Academic Infrastructure and Professional Development at SHSU-COM. And she will be doing this presentation for us as well. I would encourage you to look at our previous offerings, which I will provide to all of you in a YouTube link that we have online. And I'll give you all that good stuff. And in addition to the survey link, and your credit claim form, all that good stuff will follow the session today. But otherwise, I will go ahead and welcome and hand over to Ms. Claire Collins.
Thank you so much, Ms. Browning. Okay, so last time when you talked to Dr. Kalinowski, talked a little bit about evaluations and a little bit about bias. So I wanted to go ahead and host a session about giving feedback because as we all know, while we might evaluate a student only semi-regularly, feedback is something that should be happening all the time, especially in a clinical setting when we're talking about training physicians, whether that be our students who are medical students or even your own residents. So I wanted to go ahead and just dive right in. This is what we will be covering in this session. So our learning objectives, by the time you leave this session, you should be able to explain the difference between evaluation and feedback, because while they are often presented together, they are not quite the same thing. You should be able to identify good feedback versus bad feedback. And also I'm going to allow an opportunity for you to kind of reflect on your own experiences. And then you will be able to utilize the time and place method when giving feedback. And this is something that I made just for you all. It's brand new to the world, but it's based in literature, and I hope you find it very helpful. So to kind of kick us off, feedback versus evaluation, what is the difference? So really, evaluations are standardized. So think of like the COMLEX or any exam that you've taken, or even like a performance evaluation where every single person is evaluated the exact same way using the exact same metrics. That is an evaluation. Evaluations tend to be summative in nature, meaning they kind of sum up an entire experience or a body of knowledge. And evaluations are content specific and not person specific. And that's a really, really important piece of evaluations, is that they're driven by an actionable thing that can be measured either qualitatively or quantitatively. Evaluations should be measurable. Feedback is different because a lot of times feedback is always formative in nature, meaning it's intended to be used so that someone can improve. And that's why feedback and evaluation sometimes gets lumped together, because imagine you are a student, one of our medical students, and you're taking a midterm for clinical medicine. So you'll have an evaluation, which is evaluating your skills, and every single student is being evaluated the same way. But then there might also be in that evaluation a small piece for feedback, because this is a midterm, right? So it's meant to help a student evolve and change and get into new habits when they are entering that type of environment. Feedback should never be measuring final performance, and feedback should always be actionable. If you're providing feedback that someone can't do anything about, like feedback, if you said something about someone's general appearance that they can't help, that is of course not feedback. That's just mean. So make sure your feedback is appropriate and is something someone can take action on. If it's something that a student could never improve upon, that's not feedback. And feedback should happen often and regularly. Every time you interact with the student, there should really be, and feedback does not have to take a long time, but there should be some generalized feedback. With that in mind, I've come up with this method for you all to use in a clinical setting, the time and place method, because feedback should always be at the appropriate time and in the appropriate place. So the time is timely, predictable feedback. You want it to be location appropriate, actionable, concise, and you want to use emotional intelligence when you are giving feedback. So let's dive right in onto kind of how you manage giving this feedback using the time and place method. So the time. If you wait too long, feedback is useless, right? Because in theory, if you notice that something is incorrect that a student is doing regularly, if you do not correct the action, they will continue to perform this action. So you want to get to the students, and I don't mean right away as in you must stop everything that you're doing and correct a student. Certainly not that. But you don't want to ruminate on things too long. I often tell people that I love nothing more than to just mull things over. Feedback is not a time when you want to mull things over a weekend to determine how you're going to talk to a student about simple feedback. Don't do that. And that's because students will continue to practice these bad habits and they become more and more ingrained, whereas they need some time to process your feedback. You want to give students a chance to mull. You want to give students a chance to process your feedback and figure out how they're going to implement that feedback in their own teaching and learning and training. You also want to ensure in your timeliness that you are predictable. Okay, this is something that you really have to get in the habit of giving feedback. Feedback is a feedback loop, right? That's why I've given you a little loop here, and that you should be doing it regularly. Something that really helps students a lot is if you have predictable times when you give feedback. Maybe you give feedback after you round every day. Maybe you give feedback after seeing every patient. Maybe you give feedback and you only give feedback on Monday, Wednesday, and Friday. That's okay. But if you establish predictable cycles of giving feedback, then you have the ability to, one, trigger yourself to give feedback, and it's a habit that you get into, a routine. One of the things that I have noticed is in being more predictable about the way that I give feedback is that I'm actually giving feedback kind of all of the time, that I have really, really normal patterns, and that my staff and the faculty that I work with expect that feedback from me. They know that at the end of every meeting, I'm going to stop and I'm going to say, you know, and these are the action items that we have coming out of this meeting, or this is the way that we'll handle this next time to make sure that we're all on the same page. And that's all you're trying to do is impart your opinion and your expert advice to a student so that they can receive it. And also, one of the things that predictability helps with is some students are very anxious about receiving feedback. Not all students, some students really take it in stride. They understand that this is part of the learning process. But some students, especially because these are high performing students, they feel all feedback is negative, even positive feedback, that if you're having to talk to them about their performance, that this is some sort of gotcha moment. And having predictable feedback helps them sort of mentally and emotionally prepare to just be in a good place to receive that feedback. Additionally, if you're the type of person that you don't enjoy having to tell someone something kind of hard to hear, this establishes a cycle that protects you and it protects the students, because you both know the feedback is coming, whether it's positive or negative. And one of the things too about feedback is that a lot of people only use feedback as a negative instrument. Feedback can be either. It can be positive feedback, it can be negative feedback. Heck, if you can find a way to work neutral feedback in, by all means, do that. To just tell someone, you hit these markers, could be better, could be worse, but you're fine as is if you choose to continue on. But establishing predictability can only be a good thing for you both. The next place about being predictable is location appropriate. We've all heard the horror stories, right? Every single one of you's been through residency training. And I've heard countless physicians tell me stories about how a residency director or an attending lit into them in a hallway in front of a bunch of people and lost their temper, or heaven forbid, threw something. I've heard stories of that. And so we have definitely evolved beyond that phase, right? We don't want to assume that the way that we were treated in the past is the way we should be treating people in the present or in the future. But location is really one of the number one mistakes that people make when they are giving feedback. A lot of times what triggers feedback is actually just seeing the student unexpectedly. So if you have a student who is seeing patients with you and they have gone to lunch, and in between you've seen another patient and you've decided, oh, you really need to give them some feedback about the last patient you saw together. When the student shows back up or they round a corner, it is very, very common, because people are very busy in clinical settings, to say, oh, I have you now. Let me give you this feedback right now, right in this place. And again, that's years away from being predictable, right? Because you're coming out of nowhere with this feedback. So a student is shocked and you actually haven't collected your thoughts. So your feedback is probably not as specific or as actionable as it should be. But also, one of the things that tends to happen is people start berating a student in front of their peers. And that's a real problem for students because your power differential is all out of whack here. Think about how much influence and how much power you as a practicing physician have in a clinical setting versus a medical student. Because typically, if there's feedback, if you're doing it the right way, a student will either say, yes, I can definitely change these habits right away, or they may ask you a follow-up question and say, okay, I hear you. How would you do this? And you want that type of give and take relationship. And if you're not in a place that's location appropriate, it shuts a student down, and it means that your feedback, you never have an opportunity to close that loop. Also, if students are in kind of a group, one of the things that tends to happen is they're embarrassed, right? There's already students who don't really enjoy feedback. There's people who don't enjoy giving feedback. But if you're just with a random group of peers and someone comes up to you and they start really berating you for your previous performance, or even just giving kind but negative feedback, then medical students, especially because they're such high performers and have a lot of pride in their ability to perform, and they want to please you and they want to be good physicians, that's very embarrassing for them. And some even qualify that as kind of being shamed, being shameful. Now, I will say this, there is a time and a place for group feedback, okay? And that is when you're working in a group. So if you have students who are working in an interprofessional team, if you have more than one medical student who's with you on any given day, then giving group feedback is of course appropriate. And so I don't want you to be bothered by that. And you want to be specific, right, about how the group interacted. You're wanting to make sure that that locationality is specific to the type of environment and feedback environment that you are in. If you can keep your feedback one-on-one as much as possible, you'll want to do that. Because it just establishes a comfort level. And again, it helps put students at ease. And also the feedback, when you think about location and you think about being intentional about location, you tend to give better feedback because it's not rushed. Okay, so we've talked about a couple of different things, but the next piece is probably one of the most crucial pieces of giving good feedback. And that's that it needs to be actionable. I cannot begin to tell you how many times someone has given me the feedback, well, this could just be better. Better how? What am I supposed to do with that? Do I start from scratch? Better gets me nowhere. Or even, this was really good. I liked it a lot. That's not helpful. What did you like about it? Be specific. If you can't be specific in your feedback, if your mind doesn't lend itself to that specificity right away, I recommend a piece of paper and a pen. That actually helps a lot. So if you start writing things down and things are just very, very, very vague, go ahead and get yourself out of that mindset, because you know what isn't vague usually? Bullet points. People who are using bullet points tend to type specifically about actions and nouns and people and places, and that tends to help a lot. So if you find yourself giving feedback that you're thinking is not really very useful, give yourself some grace, because it takes a while before you learn to give good feedback. And then also go old school, pen and paper all the way. You also want to make sure that your feedback is attainable. One of the things that I see, especially in a clinical environment, is the expectation that a student who is there for a 4-week or a 6-week clerkship is going to have the same understanding or ability as a resident. And they certainly will not. They will not have that ability when they come to you, and they will not have it when they end. These are beginning learners. So to ask someone to master a skill that is appropriate for a resident isn't going to be fair to you, and it's not going to be fair to the student. It'll probably be fairly frustrating even. But make sure that the goals are attainable. If you have kind of a larger goal for students, and it is something where it's like, by the time you get to residency, you'll need to be able to do X, Y, and Z. Establish clear benchmarks for success for them. Explain what success looks like to them, or what you believe success looks like to them. That is totally fair. This is the type of feedback that our students are used to getting all of the time. So make sure that they are actionable. And also, one of the things, you heard me mention this before, but give your students an action item. So every time you give feedback, it's okay for you to give the students something to do, even if it's positive. And so let me give you an example of that. If you have a student who is really, really good, I always use the example of taking a history, because every student should be very good at that. And it's one of the key kind of features of being a really great physician is taking a good history. So if you have a student who's really, really good at taking a history, your action item could literally be, teach what you do to this other person, so that maybe you don't have to later, or write down how you learned to take such a good history. Or if they feel like there are kind of hallmarks of taking a good history and the way that they approach that, get them to sort of reflect on the experience, give them an action item. An action item doesn't have to be anything big, right? It can be telling them, by the next time we meet, I expect to see this type of change in behavior specific to this type of patient interaction. But that gives them something to grasp onto with this feedback, positive or negative, to say, this is the feedback I'm getting, and this is how I fix or improve the behavior so that I see better results. And students are aware that this is a process, and that's why feedback is iterative. That's why we keep doing it over and over and over again. Is if you've already established, right, that your location is appropriate, and that you are being predictable about your feedback, then students being given these action items, they're going to expect it. You are telling them, you've done this, and this is how I expect you to improve every single time. And that's something that they can really latch onto, and that's something that you can really look forward to as a faculty member. And I will also say too, that the better that you get at this, I will say outside of even a clinical setting, if any of you have administrative duties, which I'm sure that some of you do, giving this kind of feedback, I will say, changes the way that departments work. Giving action items kind of every single time so that students know where they are or your team is wildly helpful, because one of the things that it does is action items create consensus on a team, and it helps a team feel like you're all moving in the same direction for the same reason, with positive motivations. Okay, keep it concise. This is something that I'm hoping you all don't struggle with, but if you are someone who is nervous about giving feedback, one of the things that is very, very, very common is that you're giving too much feedback. Your feedback is 3 or 4 minutes long. You're kind of all over the place. You're trying to cram some positive in with the negative, so that a student feels better about themselves. And honestly, if the student's just, and pardon my language, kind of sucking, sometimes they kind of suck, and that's okay. Like, you start from where you start. You start as a beginner, and hopefully you become the master over time. That's okay. But just lay it out for them. Be straight. So if you try to sugarcoat things too much, you're muddling your message. There is, in giving feedback, sort of this sandwich method, right? That's really popular, where you start with positive feedback, and then you, in the middle, kind of give some negative feedback, an area for improvement, and then underneath that, you like do a little sandwich, and the last layer of bread is other positive feedback. Students don't need that. You don't have the time for it. If there is positive feedback to give them the positive feedback. If there isn't positive feedback to give them the negative feedback. That's okay. These are adults. If you have some time for a positive opener, that always helps, to just say, this wasn't a totally negative experience, because that's sometimes what students hear when you're giving negative feedback, is like, this whole thing was awful. So if it was a pretty positive experience and you just have one overall issue, it's fair to say, hey, this was a 95% positive experience. You did really well in these, 1, 2, 3, 4, 5 aspects. But in this one arena, you really need some improvement. And let me walk you through how to improve very quickly. And students can latch on to that, and you don't lose your message. If you are beating around the bush too much, you start losing track of what you're really there to do. And so that is a hindrance to you. It's a hindrance to the student. And overall, it doesn't give them a good way to grow, which can lead to poor patient outcomes in the future, right? Is we are trying to make the best physicians possible so that they can treat patients with the quality of care that those patients deserve. And so feedback is very, very, very important to that. So don't muddy up your message if you can help it. Really kind of just get to it. Now, be kind when you do that, but get to the point. Keep it short, keep it simple. And I would tell you this, if you are taking more than a minute to give verbal feedback, you're probably taking too long. So think about that. If you're spending more than a minute giving verbal feedback, that's probably too long. It means that you don't have your head where it needs to be to give feedback, and also that the student is going to stop listening, and that you're losing track of what you're trying to get across. So I talked a little bit about being concise doesn't mean blunt. You got to use emotional intelligence. Every single time that you give feedback, you really need to pay attention to things like your tone of voice. You need to reiterate kind of often that feedback is meant to be helpful, and that if the way that you are giving feedback is hurtful or harmful to the students, that they give you feedback about your feedback, right? You want to make sure that you're kind of giving the students an attaboy every once in a while, just making sure that your feedback isn't always negative all the time. It's really easy to zone in on just the things that people are getting wrong. And we don't spend enough time talking about the things that students are getting right. And it is important to reinforce good behavior, and it is important to break down bad behavior. And feedback is the mechanism by which you'll be able to do that. But if you are not being emotionally intelligent, if you're one of those kind of like classic residency directors or attendings that's doing the yelling or the throwing of the clipboards, then people don't remember the feedback you gave. What they remember is that they were yelled at, and how that made them feel. And so when you're talking about having an emotionally charged interaction, feedback shouldn't be emotionally charged. It should be very practical, very matter of fact. You should never have to start feedback with, well, I know this is kind of hard to hear. If you're starting your feedback with, I know this is kind of hard to hear, you really need to rethink why you're giving that feedback, what the purpose of that feedback is, and what your intent is behind giving that feedback. You always want to approach giving feedback from a place of mutual growth and respect. And also, one of the things that you should do is check in with your student and ask them about how much feedback do you want? How often are you going to want feedback? Because there are some students who are going to say, oh yeah, I want it every single time we have an interaction with the patient. I want it every single time we're interacting. That might be too much for you. It might be too much to the student. There aren't enough action items to cover between the two of you all, and you're needing to say, let's make this a little more regular and predictable. And you might have students who say, well, I'd really rather not have feedback every day. No, set the stage for them. Tell them how often they should be expecting that feedback so that they can prepare appropriately. Remember in the Adult Learner series, one of the things that we talked about that was really important was setting the expectations for the learner so that the learner can be comfortable coming to you and questioning those expectations. And if you do this, if you kind of walk through them what you expect, even in a feedback arena, and how to prepare for that, it only takes 20 or 30 seconds, right, to kind of position someone to receive feedback. You just say, okay, so I'm going to give you some feedback right now. Great. But go ahead and do that work. Don't just stop a conversation and then start immediately into feedback. So use that emotional intelligence where you can. Be kind to the student and be thoughtful about what you are doing. So again, this is the time and the place method. So if you're following this method, you are well on your way to giving good feedback consistently in a way that students can hear, is actionable, and they aren't going to feel like they've been emotionally battered by it. And basically what that means is you'll see good positive change, or you'll see the reinforcement of already positive habits. So I want to give some examples of what good feedback and what negative feedback, or not negative feedback, good feedback and bad feedback look like in both a verbal and a written scenario that are kind of classic examples from clinicians. So we're going to start with verbal. And we'll start with some bad feedback. So I'm just going to read this little scenario out loud. Notice I'm not keeping any of these really long, right? Dr. Bearcat pulls aside student Dr. Sammy while student Dr. Sammy is speaking to their friends. You're usually a really great student. You do a lot of things really well, and I appreciate all that you're doing, but I need you to be more careful when talking to patients. What happened yesterday wasn't acceptable, so work on that for me, okay? So it seems to me that Dr. Bearcat, right, probably came around a corner and saw student Dr. Sammy, and they saw them and were like, oh, let me talk to them about this thing that happened yesterday. They need to know that what they did wasn't right. So location is an issue, right? We've already established student Dr. Sammy's with their friends. And that also, this probably establishes that Dr. Bearcat doesn't give predictable feedback because they hadn't already addressed this with student Dr. Sammy. The timeliness is also not great, right? Because this happened the day before and it was an issue. And also, is it actionable? What is student Dr. Sammy supposed to do with this feedback? You do a lot of things really well. Great. What are those things? I appreciate all that you're doing. It's always nice to be appreciated, I suppose, but I need you to be more careful when talking to patients. How? What did student Dr. Sammy say that was a problem when speaking to a patient? What was the issue there? This is not specific enough for them to be actionable. So, and then you say, what happened yesterday wasn't acceptable. So if you're walking away from this, right, and student Dr. Sammy is left sitting there talking to their friends, they're embarrassed because you've called them out in front of your friends. Something they did wasn't correct, but also wasn't acceptable is pretty harsh language. How bad was this issue? To me, that would mean it was probably pretty bad if I'm the student, that it wasn't acceptable. But also there's no specificity here whatsoever. But this is the kind of feedback people give really pretty regularly. I myself have given feedback exactly like this before, when I'm like, you just need to be more careful when you're doing this thing. Okay, what was I doing that was wrong? Make sure you're really focusing in on that. And so try to be very specific. And this is what good verbal feedback might look like. So immediately after talking to the patient, Dr. Bearcat talks to student Dr. Sammy in the hallway. The hallway is busy, but they are mostly alone. You did a wonderful job taking the history of our patient. You asked good questions and were respectful throughout. However, I noticed that several times you casually touched the patient to offer comfort. Please do not do this without letting the patient know that you're going to touch them. Consent to touch is extremely important in establishing a good doctor-patient relationship. Okay, so this is someone that we said immediately, right? So this is if student Dr. Sammy is aware that every time they talk to a patient, Dr. Bearcat is going to be giving them feedback, then this is predictable feedback. Student Dr. Sammy is expecting that as they move down the hallway or near to the next clinic room, that they're going to get a minute worth of feedback from Dr. Bearcat before they go into the next patient. Then that's fine. That gives student Dr. Sammy a way to prepare to say, hey, I'm going to be getting normal feedback. Again, the hallway is busy, but they're mostly alone. Assuming that Dr. Bearcat is not yelling at student Dr. Sammy, that's fine. You know, you don't need complete privacy, right? Sometimes a really crowded hallway that's loud offers sort of its own island when two people are talking. You don't have to worry so much about issues like this. Again, there was some positive and some negative in here, but it was still pretty concise, right? So the positive piece, you did a wonderful job taking a history of our patient. Okay, that's specific, but it wasn't super specific. But then Dr. Bearcat got more specific, which was great, which was the part of the history that you did a really good job with was asking questions and that they were respectful. So this is a habit that student Dr. Sammy should keep doing over and over and over again. So you already got specific saying you did a good job with the history, but then Dr. Bearcat went at the extra mile and said, and these two aspects of taking history was the thing that you really excelled at. And so that's great reinforcement of positive behavior. Then leading directly into, however, I noticed that several times you casually touch the patient to offer comfort. And what this does is this establishes that emotional intelligence, right? Dr. Bearcat understands why student Dr. Sammy reached out to touch the patient. This is a very common human interaction, right? To touch someone to soothe them. However, if you don't have the trust, if you don't have that doctor-patient relationship, we should be talking to these patients about, oh, I'm going to touch you now, right? Like that's one of the things that we do. If you're going to take blood pressure, someone says, oh, I'm going to take your blood pressure now. I'm going to listen to your heartbeat, and they show you that they're going to do that. We're always establishing that there is consent in these environments. So this is a good way to kind of reinforce that the student did something out of the kindness of their heart, but that was not correct, okay? And so this is feedback that the student can hear. Additionally, Dr. Bearcat explained why this wasn't appropriate behavior. And they said the consent to touch is extremely important in establishing a good doctor-patient relationship. So this student has received good feedback and negative feedback all in once. It was concise. And the action item, right, is please do not touch patients without letting them know that you're going to touch them. So this is something that student Dr. Sammy knows that Dr. Bearcat is going to be asking about or looking for in the future. So this is something that they can be aware of in every single interaction they're having with the patient in the future. And so the next time that student doctor goes to offer comfort by like taking someone's hand or their elbow, then they just don't. They just give themselves a quick check to make sure that they had that really important patient consent. So Another way that people get feedback, right? We talked about evaluations last time. A lot of times in evaluations, you're asked to give some feedback about students, about their performance or ways that they could improve. And sometimes that is so that the student can improve. And sometimes it is so other people can read what the feedback is about the student. So residency directors, right, classically read your evaluations and your comments, but then also your feedback on areas where the student did really well or could improve over time. Because remember, this is still considered formative feedback because the student's training doesn't end with you. It ends at, and really truly because you're doing CME, your education really never ends as a physician. But in theory, for the purposes of this presentation, we'll say that their education ends in residency. So this is good feedback for residency directors to view where the students are in their learning process so that they know where they need to pick up as residency directors. So really rather classically, this would kind of be an example of bad feedback, even though it is positive feedback. When giving feedback on evaluations, clinicians are people of few words. And what I would encourage you to do is you don't need to be super verbose, but you should give a well-rounded and thoughtful feedback or piece of evaluation. And so this is something that I've actually seen before. They got tacked right into a student's MSPE, or as it was formerly called, a dean's letter. And it just says, student Dr. Sammy was a good student when working with me. I like them a lot and could see them as a colleague in the future. This is not helpful, even though it's positive. It is not helpful to the student, nor is it helpful to a residency director. Student doctor was a good student when working with me. Great. Why were they a good student? What do you do? What kind of rotation were you on? Be specific. I like them a lot. Okay. Why? Why did you like them? Was it a personality thing? That's all I can read into this, was you like their personality. Maybe y'all like the same sports team. Who knows? But likability does not mean that someone would be a good doctor. I could see them as a colleague in the future. What does that mean? What is the thing that made you decide you could see them as a colleague in the future? Did they display a positive characteristic that you just really latched onto? What skills did they show you that made you think, wow, I just really love to have them as part of my practice, or as a colleague here in my clinical setting? That this doesn't really work. So what I recommend is something like this, and it's not too much longer, right? Not too much, just a couple of quick sentences and still kind of to the point, right? Because we're talking about being concise. One of the things that's nice about being concise is it's short, easy to read, gets to the point, and doesn't waste your time. So in good feedback that's written, you might say something like, student Dr. Sammy was a joy to have on my clinical rotation for general surgery. They were prompt, well-read on the latest techniques, and picked up a number of new suturing skills during our time together. Student Dr. Sammy worked with interprofessional teams at our hospital and exhibits high levels of professionalism. Okay, this is short and sweet, right? So we don't really know why student Dr. Sammy was a joy to have on the clinical rotation, but that's a pretty positive statement just overall. It's just, it was an overwhelmingly good experience. And we know, right, it was general surgery. So that's important. They were prompt. Okay, so this person is always on time, which signals to a residency director that they are reliable. It also reinforces to the students that this is something that's very valued in a clinical setting, that we want to encourage students to be prompt. They were well read on the latest techniques, meaning the student is a self-starter, they're motivated, that this is something they should continue to keep doing. If you're a residency director, it means that you don't have to pick up the slack. It means that the student is preparing themselves, that they want to be additive to the clinical environment, and they don't expect you to do a lot of hand-holding that you don't probably have time to. And they picked up a number of new suturing skills during our time together. Because clinical rotations are short, this is an overwhelmingly positive statement, right? Is that if they picked up a number of new suturing skills, even though you didn't go into depth on what those suturing skills might be, that doesn't really matter. What you're showing is you're telling the student, I like that you have the ability to learn and learn fairly quickly, and that you are adaptable and flexible, and that you take direction well. To a residency director, those are really, really valuable skill sets, right? You want someone who who values your time, who is a self-starter, and then also is teachable, right? This student is saying, I am a sponge, teach me and I will thrive. But also, if you don't teach me, I will learn on my own. And then to kind of wrap it all out, it says student Dr. Sammy worked with interprofessional teams and exhibits high levels of professionalism. Now, the way that this could have been improved, right? Because this isn't a perfect piece of feedback. That's not the point here. You could have said, what was your role on this interprofessional team? What type of IPE event was this? What type of interprofessional setting was it? Who were they working with? Was it nurses? Was it speech language pathologists? Was it a bunch of different kinds of people? Was it pharmacists? And while that level of specificity would be nice, it's not really required, because at the end of the day, the thing that this person was trying to give back as a form of feedback was that they exhibit high levels of professionalism in a clinical setting and working with interprofessional teams. And so we know that that is something that is really highly valued in a clinical setting. And we want students to continue to reinforce those kinds of behaviors and work well with the other faculty and staff that they'll be working with in a clinical environment. So this is a good piece of feedback, right? It's not perfect, but if this is what you wrote, let's see how many sentences this is 3 sentences. If you don't have time to write 3 sentences, we really need to reevaluate things. On average, I would assume that this probably took 2 minutes, maybe 3 minutes to write, whereas this probably took 45, 50 seconds, maybe a minute, but tells me nothing. Add 2 minutes, knock it out of the park. So where I kind of want to leave you all today is reflecting on your own experiences receiving feedback. I'd like you to really start thinking about some times in your training when you received feedback and what was impactful to you, both in positive and negative ways. And if any of you have been lucky enough to have a mentor in your clinical setting, or just a mentor in general, one of the things that you'll probably see is the reason that you value that mentorship is that your mentor gives good feedback. And so if you are doubting your ability to give feedback, one of the things that you might do is they say imitation is the sincerest form of flattery. And I think that that could be very well applied here as well, is fake it till you make it. So if you need to kind of give yourself a little guide and you just want to write down time, place, so that you remember every time, that's fine. Go ahead and do that. If you want to copy a style that your mentor does, that's fine too. But really do some reflecting on what kinds of feedback did you find were useful? And then also really kind of hone in, and I know that this might be uncomfortable for some of you, but when did you get some bad feedback? Like the feedback was genuinely worthless, you couldn't do anything with it, or when was it even hurtful? A lot of times, one of the things that I've seen is someone receives hurtful feedback and it's considered hurtful because it's not actionable. It's not something that someone can change. It's something that's just a part of them or a standard operating procedure. And for some reason, a student is being held accountable for that in a learning environment. And that's not fair feedback. So just kind of mull that over and start preparing yourself to giving feedback. I do recommend going ahead and writing down the time and place method, just so that you have that in your pocket. If you want to put it on a little notepad and stick it in your pocket, that's probably a great idea. And our students, you know, I promise if you have to pull it out and read off of it just to get yourself in the habit, I promise our students will never make fun of you for that. I do stuff like that all the time with them. And then the final thing I want to kind of leave you with as an action item is a resource for you, which is the 1-minute preceptor from STFM. As a preceptor, with SHSU, you do get registered with STFM, and the 1 minute preceptor is actually a guide to giving feedback and how to give feedback in basically a minute. We've mentioned this resource before in our very first CME session, but I wanted to bring it up again because it really just is so valuable and kind of gives you some tips and tricks for giving valuable feedback in a way that doesn't suck up a lot of your time so that you can get on with your day. Okay, and so finally, here are the references that we used today. I want to thank you so much for your time and attention this afternoon as we learned how to give valuable feedback, and we will be back next month with our next session. And if there are any questions, I guess we can put that in the chat now. You are muted, Ms. Browning.
What about now?
You're coming in loud and clear.
Okay, I'm so sorry. I don't know. The settings just decided to change themselves. Welcome to Zoom Live. Okay, as promised, I wanted to thank you, Ms. Collins, for offering this session for us today. I hope you all gained a ton from it. As promised, we're going to have this recording made available to all of you on our YouTube channel, which I will send out in a follow-up email. And I will also go ahead and put in the chat the assessment link so that you can go ahead and take that. And again, we'll provide that in a follow-up email. If you ever have any questions, feel free to reach out to me. You have my contact information. And otherwise, we look forward to seeing you all next month for our next session. Thanks and have a great afternoon and weekend.